Please welcome Daisy Fancourt, who is the Associate Professor of Psychobiology, Epidemiology at the University College London, yes, sorry, got that right, thank you.
Thank you very much.
Hi, Daisy.
It's a pleasure to be speaking to you today, and I'm going to be talking to you about the Rome Charter, which I very much welcome as a fantastic new document. And I want to talk about the implications within this charter for public health and population health. I'm going to start by talking a little bit about the work that's been done with the World Health Organization over the last few years in trying to prioritize and promote the importance of the arts for health. And then I want to come on to talk specifically about the charter and about how the charter integrates health and the implications that the charter has for health within Rome and I think internationally. Now, when we talk about engaging with the arts, of course, the primary motivation for this amongst most people is for the joy and inspiration that the arts bring. But either inadvertently or unconsciously, the arts can also have profound effects on our health. We often think about this as the arts consisting of multiple different components of different active ingredients that can be good for health. So, for example, engaging with the arts involves the imagination. It activates the senses. It helps us to evoke emotions. It's cognitively stimulating. Often it involves some element of social interaction or physical activity. Now, these components have all been shown to be beneficial to health. And in fact, over the last year, I've worked with my research team, and we've identified over 600 causal mechanisms that can link engagement with the arts with health outcomes. These can include psychological mechanisms, such as things like coping, self-efficacy, and well-being and mental health benefits. They can include physiological mechanisms, such as reducing stress hormones, improving immune function, helping to build physical strength. They can involve social mechanisms like reducing loneliness and isolation, enhancing social support and social cohesion. And behaviorally, the arts can also help to improve motivation, meaning that people are more likely to increase their behaviors related to health and adopt healthier lifestyles. All of these different mechanisms have then been shown to help to prevent different mental and physical illnesses or to help in their management and treatments. But there are two vital things here. The first of them is that whilst many different activities contain these different beneficial components, what the arts are very good at is combining multiple components together at once. And because most people engage in the arts for the joy of it, this actually means that there is an intrinsic motivation to do the arts, bringing these components along, almost like a vehicle. And if we contrast this with health interventions, for example, often one of the barriers is around that motivational component. The second thing here is that the arts don't just work at an individual level. We've identified causal mechanisms that can work for yourself, such as going to cultural spaces or cultural activities, reducing loneliness. But also at a group level, doing those things can help to build group bonding. And if we have lots of these activities available within communities, we can really start to build group level social cohesion. So the arts can operate at multiple different levels simultaneously. So it was with this premise that with the World Health Organization, we started collaborating a few years ago, and we undertook a scoping review of the evidence of whether and if and how the arts can improve health and well-being. We looked very broadly at data from clinical trials, laboratory studies, different qualitative methodologies, and also from big data and epidemiological approaches. And in total, we found over 3,000 studies that we included within the report. These generally grouped into two categories. The first, looking at how the arts can help to prevent mental and physical illness and support health promotion. And the second, around how the arts can play a role in the management and treatment of different conditions. And I want to outline some of this evidence base to highlight the breadth and depth of impact the arts can have. Starting with prevention, the arts can play a role in supporting social determinants of health. For example, they can help to build social cohesion, and they can also, if carefully applied, help to reduce social inequalities. This is an important point, as I welcome Pierluigi's comments here about the fact that the arts can often be something that is used most by the privileged. But actually what we found is that in recent research, people from most deprived communities often have disproportionately larger responses to arts engagement. So in other words, the arts can help to reduce inequalities if we can find a way of engaging everybody equally. And of course, I'm going to return to this when talking about the Charter. The arts can also support in child development, helping mother-infant bonding, speech and language developments, and playing a role in educational attainment. The arts can support caregiving, helping people to understand health from different perspectives. The arts in medical training programs have been shown to improve the clinical skills of doctors and nurses, and they can also improve staff well-being, a really important thing at the moment when we're facing a health crisis globally, with many staff facing burnout. The arts can also play a role in the prevention of ill health, helping to improve well-being, helping to reduce the risk that somebody develops depression or anxiety, playing a role in the maintenance of good cognition as people age, and also in good physical function, like helping to reduce the incidence and trajectories of frailty. And there's even literature on all of these effects adding together to show associations with a lower risk of premature mortality. And the arts can also support health-promoting behaviours, including playing important roles in health communication and the way that we discuss illnesses between different cultures, helping to reduce health-related stigma, and sometimes being able to play a role in reaching hard-to-reach groups. In terms of management and treatment, the arts have been shown to play an important role in reducing symptoms of perinatal mental illness amongst mothers, as well as helping to manage and reduce the symptoms of other types of mental illness. The arts have been shown in clinical settings to play very important roles, often in stress and anxiety management, for example, in premature infants, people undergoing surgery or invasive procedures, and people in intensive care. And this has been shown through psychological anxiety and biological markers of anxiety as well. The arts have been shown to play very important roles for people who have developmental and neurological disorders, for example, helping in communication and helping people to be able to socialize, to be able to experience emotionally, and to be able to identify the symptoms they're experiencing and communicate these better. The arts also have an important role to play in the mental health and well-being of people with non-communicable diseases. Again, we see important research here about things like the management of illness and adherence to treatment regimes being improved amongst people who have access to the arts. And finally, the arts have for a long time played an important role in palliative care and bereavement as expressions of grief and helping people to manage their emotions. So this shows the strength and depth and breadth of the literature that we're seeing on the importance of the arts in health. Within the report, we therefore make some recommendations, one of which is to acknowledge this growing evidence base, supporting the implementation of new interventions, sharing effective practice, and supporting research that will help us to understand more about how the arts affect health. We also talk about recognizing the added health value of the arts. So the fact that the arts can almost be an in-kind resource for health if we have more cultural activities for people that can help to improve well-being and maintain good health, this can reduce the load on health services. We also encourage arts and cultural organisations to make health a part of their strategies and to actively promote the public awareness of the benefits of engaging in the arts. And we also highlight the importance of cross-sectoral research that will help to build bridges between the arts and cultural sectors and the health sectors. And we're seeing in many countries now programs like social prescribing that actually refer patients through to engaging in the arts to improve their health and well-being. So alongside this report, we've also been looking at the policy implications of this. And this is where I want to start considering what we're seeing within the Rome Charter and also other charters that have come out recently. If we look at the Sustainable Development Goals that the World Health Organization has set, we can see that the arts can help to achieve multiple different goals. For example, helping to promote well-being at different ages, helping to ensure and promote lifelong learning for people. We highlight in the reports how the arts can help in raising awareness of issues around gender equality and the fact that the arts often as a sector provide many employment opportunities for women. The fact that the arts can play an important role in economic growth and how, when applied carefully, they can help to reduce inequality. And finally, we highlight that the arts can help to build inclusive societies. Why the arts, of course, we might ask? Well, the arts can provide solutions for challenges where we don't currently have solutions. They're often cost-effective activities to promote for people because they can have so many benefits. I've just spoken specifically about health here, but we see benefits across other domains as well, for example, education. When we look at the priorities of Health 2020, they're about catalyzing action from other sectors and helping to build resilient communities. And of course, these are themes that are echoed within the Rome Charter itself, this importance of community. We also looked at the World Health Organization's General Programme of Work, which focuses on increasing human capital and helping to accelerate action on mental health. And also at a time where we're facing challenges in resources, drawing on other sectors to support health and well-being feels more important than ever. So this brings me to the Rome Charter. I particularly welcome in the Charter the reference to Article 27 of the Universal Declaration of Human Rights, the idea that we need to protect everybody's right to participate in cultural life in the community and enjoy the arts. And this is, again, I think, the stress on everyone's right and the importance of addressing inequalities in participation. And I think what we really see from the Charter is how to implement this to improve lives. So I thought I would end by talking about the 5 different messages within the Charter and just mentioning about the relevance that these have specifically to health and why this Charter helps to flag the importance of health and well-being. There is a focus on discovering cultural roots and recognizing heritage, identity, and place. These are fundamental social determinants of health as well. If we can help people to discover their cultural roots and recognize their own identity, then these are things that we know help to improve health. In other words, we achieve 2 goals in one. Creating cultural expressions is not just important culturally, but it's also a form of health behavior. Sharing cultures and creativity can help to support social cohesion and social support, both fundamental activities in trying to promote healthy societies. Enjoying cultural resources and spaces can provide benefits to mental and physical health, helping to reduce sedentary behaviours, get people into the communities more, connecting with others. And protecting our common cultural resources is vital to support the sustainability of culture. If we don't protect our culture moving forwards, it's likely not just to adversely affect culture, but also to adversely affect health and well-being. So I'm so delighted to see these priorities within the Charter because I feel that they will benefit both the cultural sector and also benefit population health. Thank you very much.